My friend from Arizona and to the leader that a cynic might also raise the issue of why it took the president 454 days to nominate Donald Berwick, and then have a lot of his surrogates go on in front of the media and say, you know, we had to do this because we needed to get this position filled. 454 days. If this position was so critical and so important to this country, you'd think that they would have moved in a more expeditious fashion to get a nominee out there. They didn't even have a hearing in front of the committee. They could have had a hearing, they could have had a vote at the committee level, they could have brought him to the floor. They didn't do any of those things that would be called for under regular order, because I think the senator from Kentucky has pointed out, they did not want to take a tough political vote. And when you look at this man's record and the things that he has said about the British health system, and some of the other comments that he's made, I want to point out something here, too, which I thought was sort of interesting, because he's going to be called upon to implement a 2,700-page bill, which, when the regulations are written, is going to be thousands and thousands of pages, not to mention the fact that, as we debated this thing on the floor of the United States Senate, it ended up being about $1 trillion. When it's fully implemented, $2.5 trillion. And so he's got trillions of dollars under his jurisdiction. He's got a 2,700-page bill that he's going to implement. And he came out and said that I don't feel like a leader, so it's very hard for me to project myself into that situation. But inattention to detail is my biggest defect. I'm always leaning forward into something new. I can create a mess. Luckily, I have people who are willing to create the detail around the idea, or if they're really smart, know which ideas to ignore. He's basically saying that he's going to be, he's not a detail guy, and yet this massive new health care program, which is literally going to be thousands of pages and regulations and 2,700 pages, as I mentioned, in terms of the legislation itself, that he will be called upon to implement. And he has a vision, clearly, that the model that he supports is the British health system, the national health system, which, as we all know, countries in Europe are moving away from that sort of a model, and why we would be moving in that direction and why they would appoint somebody like this to this important position really defies explanation. But more importantly, I think as well, is that they could have done this in the regular way. He could have come before the Senate and answered questions like any other nominee would. He should have had a hearing where he was able to respond to some of these statements that he's made in the past, and yet they chose to do it in this way with a recess appointment, notwithstanding the fact that it was 454 days before they put his name forward for nomination, and since that time 79 days, and they're blaming the Congress and they're blaming the Republicans specifically for not moving this nomination, when in fact it was the President and his administration who waited that long to put somebody in this position. Could I ask? Wyoming knows full well how difficult it is to deliver health care in rural areas, being a physician himself, and the challenges that you face. And it seems to me, at least, that notwithstanding their comments to the contrary, you have to look at what people do. And in this case, what the administration has done is appointed somebody to run this massive new health care program, which clearly is on the record by his previous statements in favor of redistribution of the wealth, in favor of rationing of health care, and in favor of government-run health care. I mean, he's romantic about the British national health system, which, as you mentioned, is having all kinds of complications and problems, runaway costs, and now they're trying to figure out a way to move away from it. The problem they have is 1.6 million people are employed by the British national health system. It is a huge employer in their country, and of course so the economic impact, the political impact of making changes in that system are very difficult. But that being said, it doesn't look like they have many choices, because they're facing such difficult fiscal circumstances in their country, and they're seeing this runaway health care cost contributing in a very significant way to that. So it seems to me, at least, that what we have done here with this massive health care bill that passed in the United States Congress, $2.5 trillion when it's fully implemented over a 10-year period. And what we're already seeing is now the actuary at CMS coming out and saying that it's going to bend the cost curve up, it's going to cost considerably more, way above and beyond what the normal year-over-year inflationary increases in health care that Americans had already been seeing. And you also have the CBO now coming out and saying that it's not going to achieve the deficit savings that was advertised here on the floor when we had that debate. There is all this information coming out which validates the arguments that we were making at the time, and that is that we don't want to move toward a government-run health care system that rations care And in this case, of course, as I said, you put somebody in charge of this who believes in redistribution of wealth, rationing of health care, government-run health care, all things that we argued this would lead us toward. And clearly, I think the administration, that they really show their hand when they put somebody like this to run this important and comprehensive and wide-reaching and expensive and bureaucratic program that very much will resemble, in terms of a model, what they're doing in Britain, which Britain clearly is moving away from.
Madam President,
on that, again, 454 days before the administration put forward this nominee, there has been 79 days since, and they are blaming Republicans for holding up this nominee. Again, notwithstanding the fact that it was 454 days before they ever put him forward. And again, if you don't have a hearing, and he doesn't have to come in and answer questions about some of these what I would characterize as outlandish statements. It is an abrogation of the responsibility that the administration has in working with the Senate and the Senate's power, advise, and consent to at least have a hearing, to at least have a vote, to at least have some public discussion about this gentleman's qualifications and his attributes with regard to this important position that they're going to appoint him to. And I wanted to point out, too, that there's one other example of this. The TSA administrator, which is another really important job, by the time that they actually got somebody submitted that could be acted upon here in the United States Senate, 482 days had lapsed. Now, it was 520 days, 21 days when the new TSA administrator was finally approved. But we went 240 days while the post was vacant, from the time that it was vacated in January of 2009 until they appointed their first nominee, who then had to withdraw because of problems. They appointed somebody else who withdrew because of problems. And then they finally submitted somebody that actually was approved, but it took 521 days. But that's not us. That's not the Republicans in the United States Senate holding things up, nor is it the case with Berwick's nomination, where 454 days lapsed before the administration put his name forward. And then they just quickly, without giving us an opportunity or the Senate an opportunity to do their job, recess appointed him to a position where he's going to be responsible for thousands of employees, obviously billions and trillions of dollars when it comes to the health care delivery in this country, and that's really unfortunate. And so as the senator from Arizona has pointed out, it's partly about this gentleman and what he stands for and what he intends to do with this position, but it's also the process by which he was actually put into this position and how it completely short-circuited and bypassed what is regular order and what should be, under our Constitution, the responsibility of the Senate to provide advise and consent. And his constituents very well, and we share a border, but we also share a lot of other things, and so it's a common set of values and sense of individual responsibility, belief in freedom. And I think that what this gentleman represents in terms of his view is completely contradictory to what the majority of my constituents, and I'm sure the majority of the senator from Wyoming's constituents in his state, would say with regard to how you ought to approach issues. That you don't, the American individual, the American consumer is much better positioned to make decisions about their own health care than is some government bureaucracy here in Washington, D.C. And what essentially Mr. Berwick has concluded over time, and this is a long career that he's had in analyzing and studying many of these issues, he's come to the conclusion that a government-run system where the government, some government bureaucrat is in the position of making these decisions that are important to an individual, in this case his health care or her health care, that's clearly a model that he endorses and supports, and it's very contradictory, I would say, to what I think the view is of the majority of Americans. And frankly, one of the reasons I think that many of us opposed the health care bill when it was under consideration here in the United States Senate, and the senator from Wyoming made some excellent remarks, comments during the course of that debate about his experience with health care as a practicing physician, that clearly the American model is one that is very different from the European model. And what you have with Mr. Berwick is somebody who would like to remake the American healthcare system in the image of the model that we see in places like Europe, and his example of the British healthcare system, about which he is romantic, is a good example of how he intends to implement the health care bill that was passed here in the Senate. And what we argued all along was the intention of those who were behind it, and that is to move us more in the direction of a single-payer, a European-type system, as opposed to what we've experienced in this country and enjoyed for such a long time, and that is one that's based upon, has its basis at least in the market, where you've got individuals who are in charge of making many of the decisions as opposed to some government bureaucrat. And so this is very unfortunate in terms of the fact that this was an appointment that was made in the recess without the normal process being adhered to, and this gentleman being able to come in front of the Senate committee to answer questions and to actually have a vote here in the United States Senate. It is and for our colleagues on the other side to argue that the reason they had to do this was because Republicans were slowing or somehow delaying this process is just completely inconsistent with any of the facts. As I said before, 454 days before the president put his nomination forward. It certainly isn't the Republicans' fault that they didn't have a nominee up here, and then the fact that they didn't have a hearing, that there hasn't been a vote at the committee, and now not a vote on the floor of the United States Senate, I think is really unfortunate, given the consequences and the impact that the person who occupies this position is going to have with regard to delivery of this new health care reform legislation.
And it was interesting.